All right. So good evening, everyone, and thank you so much for all who are joining today. Today is January 21st, and we have a very special session starting this year. And Sanjeevani is really proud to welcome Dr. Pinky Arora, who is going to be assisting clients for a guidance in healthcare. I know uh, the careers are many and everyone tries to bring in some level of work into our daily lifestyles. There are very few sessions which focus mostly on healthcare. And thank you so much, Dr. Arora, for providing the time and the guidance to our clients. The floor is all yours. Would you please share a brief introduction about yourself?
Sure. Good evening, everyone. Hi, my name is Dr. P Arora. I am a craniofacial specialist and a sleep apnea specialist practicing out of Naperville. Thank you all for coming and attending this guidance session tonight. As most of you know, healthcare careers are very sought after and unaffected by economy, whether the economy is up or down. One thing is for sure that healthcare jobs will always be there and there'll always be openings. And as per the latest predictions, we are expecting a very high demand in this field. There already is a significant shortage of reliable, ethical, hardworking folks in the healthcare settings, folks with good moral values and compassion. Healthcare is quite a vast field, so I have tried to cover mostly all of it in this informative session. Hope it helps those considering this noble profession and make the right choices. My sincere apologies if I have missed any areas. My presentation includes some basic guidelines, how-tos, academic requirements, roles, and pay scale, etc. I have also recapped on GED, for those who have not completed high school or are from a different country and their high school scripts have not been evaluated, and also ECE, which is for evaluation of your credits from if you're a foreign trained individual in either healthcare or here from another country and has a college degree and want their credits to be evaluated. After I'm done presenting, we will invite questions from the audience. I will also have one-on-one sessions with interested candidates after the session to help and pretty much hold hands to get them through this journey of finding the right profession for them within healthcare and finding the right schools, finding the right certifications, and getting through to good jobs. So I am ready for my presentation.
Sure. Thank you so much, Dr. Arora. We also have today the career coach from Sanjeevani, Shatabdi Chaudhary. So I'm sure we have a lot of clients reach to her for questions, and definitely she will be asking you on their behalf. So you can start your presentation, and everyone kindly hold on until the presentation gets over. And any questions can be submitted through chat or to Dr. Arora directly.
Thank you, Dr. Thank you, Pramila.
I will not yield. Britain will not yield for our.
All right. So here's my presentation. Why choose healthcare careers? Sorry. Second, little glitch here. Sorry. All right. So healthcare gives a lot of purpose and fulfillment. It gives a lot of profound sense of purpose found in helping it. You are helping others, and you find there is a lot of purpose in that. It directly impacts lives by providing care to individuals and alleviate their suffering. Improving health outcomes is very rewarding, as some of you already feel when you go to a doctor or any healthcare setting, and you are being exposed from the very front desk person who welcomes you to the last person you see or go for any blood work or any kind of lab test. You will realize that they are putting so much compassion into their work. So it is definitely a very rewarding field. It definitely has a lot of job security and stability. It's a continuously growing sector, high demand and stability even during economic downturns. By 2030, the US faces significant healthcare workers shortage, especially for nurses, potentially, and that's the prediction number right now, which is the about 64,000 nurses shortage, and primary care physicians, tens of thousands, driven by aging population needing more care and mass retirements. You all know that people are living a lot longer. People are focusing and paying a lot more energy and money into preventive care, which means that more people are needed to provide them with that care. It is financially very rewarding. It has very competitive salary. Most of the times, these salaries are above the minimum wage, and they have benefits, bonuses, travel reimbursements. The salaries are well above the median for all occupations, and everyone knows it is a very highly respected field, and because it plays a vital role in the society and care for individuals. Career variety and flexibility, direct patient care. So there are a variety of roles that involve direct patient care, and I'll be going more into the details of that. There are administrative roles, research roles, and even telehealth in today's technology age. Many specializations are available. Diverse environments where there are clinics, small clinics to large offices, schools, homes, and various locations. And options are also available for flexible hours, even for remote work. There is continuous growth. There's endless opportunities for lifelong learning. There are new experiences and upward mobility through education and training. And honestly, in healthcare, sky's the limit. You can never saturate. In every field that I'll be discussing, you can continue to get more certifications, get more education, more training, more skilled training, and continue to grow in that path, not which also rewards you financially, and it is rewarding for patient care or in a non-patient care setting because you are never saturated. There are different and diverse roles. There are clinical roles like doctors, dentists, chiropractors, optometrists, therapists, nurses, counselors, patient care technicians, medical assistants. I know these terms, some of these terms sound like you've never heard them before, or they sound too complicated, but as my presentation progresses, you will understand the roles of all of these, and many a times you, even as a patient, has come across one of most of these clinical people. Administrative roles include healthcare management, billing, medical coding, schedulers, people who schedule your appointments, and health informatics. Technical roles are lab technicians, radiology techs, phlebotomy techs, sterile processing techs, people who take care of the infection control, and plasma center techs. What are the diverse settings? There are hospitals, private practices, senior living facilities. You will be surprised how many healthcare workers are needed in senior living facilities. Nursing homes, labs, plasma centers are becoming very common. Community centers also always require healthcare workers. Research facilities, schools always have healthcare workers. Telehealth always is in demand. What is the average pay? So the average pay for a healthcare professional starts pretty much from $17, and the minimum wage in Illinois right now is $15. So you can already see that the absolute basic starting pay for a healthcare worker is $17. That's only when you barely get your foot into the door. And then after that, I told you, sky's the limit. You take more certifications, you get more education, and there is a lot more you can do, and a lot more financial benefits come with that. Average pay for healthcare support staff that is not licensed doctors is anywhere from $17 to $75. Doctors' pays are anywhere from $110 to $150 an hour, and it only goes upwards if you decide to go into any specialized field. What are the different careers? Now, this is a lot on one slide, but I wanted to keep it all in one page because I wanted to have everyone get an idea of how vast this field is. With clinical degree, these are the licensed roles. There's medical doctors, dentists, optometrists, people who you go to see for an eye exam, and they do the eye exam, give you a prescription, and you get your glasses, your eyeglasses. I'm wearing one. Can't be without that. So we can't be without optometrists, chiropractors, physical therapy doctors, pharmacists, physician assistant, nurse practitioners, psychotherapists and counselors, physical therapy assistants, and dental hygienists. Now, please make a note. And if any of you, now this is getting recorded, but if any of you wants to take a screenshot or take a picture of this, this summarizes all the different careers with licensed roles that you require a clinical degree for. Then there is support staff, where the license is not required, but certifications are preferred. There are nurses under this role, medical assistants, PCT, that is the patient care techs, NCT. So in olden days, they used to be also called NCTs, and some states still use that term, so I included that here, which is the nursing care techs, CNAs, which is the certified nursing assistants, phlebotomy techs, pharmacy techs, and dental assistants. Now, there is also administrative staff where no license is required, but certifications are preferred. There are medical administrative people, there are medical billers and coders. There are offshoots of the PCT and CNAs from the support staff category that are plasma care techs, sterilization techs, lab techs, radiology techs, and radiation techs for cancer patients. Now, the reason I have them listed under offshoots of PCT and CNA is I'm going to go into the details of this, that PCT and CNA are your best ways to get your foot through the door for these roles. There are a lot of roles that emerge from that. And as we progress, I'm sure in future there will be a lot more that will be added into this category. How-tos for all of these now. How to become a doctor. So a doctor's degree is called MD. You do undergraduate education for 3 to 4 years right after high school. You take the MCAT exam, medical school for 4 years. Then you take the licensure exam for that particular state where you reside. That is residency training for 3 years in a hospital setting. So the total length of education and training is 10 to 11 years. This is by far the longest career path in healthcare field. Obviously, with the length comes the financial benefits. Dentist is the next one. DDS, DMD are the degrees. Undergraduate education for 3 to 4 years after high school. Then you take the DAT exam, which is the dental aptitude test. Then dental school for 4 years, which includes the clinical experience for last 2 years. Licensure exam in your state, and total of 7 to 8 years of education to become a dentist. Doctor of Optometry, which is the OD degree. You do the undergrad education for 3 to 4 years. Optometry education admission test, which is the OAT. OD school, which is the optometry school for 4 years, which includes coursework and clinicals. Then you take the licensing exam in your state. And so this is also about 7 to 8 years of education and training. Chiropractor are degree called DC. Undergraduate education for 3 to 4 years. Then there is chiropractic school for 4 years. Licensure exam in your state. Total of 7 to 8 years of education and training. Physical therapy doctors, which are the degree is called DPT. There is undergraduate education right after high school for 3 to 4 years. Physical therapy program is for 3 years. Licensure exam within your state. So total of 7 to 8 years of education and training. Pharmacist, which is called the Pharma D. Undergraduate education for 3 to 4 years. Pharma D school for 3 to 4 years. Licensure exam and total of 7 to 8 years of education and training. Physician assistant, which are also called the PAs. Many times now when you go see a doctor, if you're going in for an emergency or for a small follow-up visit or a small sickness, many a times there is such a large shortage of doctors now in the United States that you will actually end up seeing a PA. And so to become a PA, you will need to do the undergraduate education for 4 years, PA school for 2.5 to 3 years, depending on the school, license exam in your state. So it's 7+ years of education and training. If you want to do any specialization, then there is additional residency training for 1 to 2 years in the field that you choose. Nurse practitioners, which is the BSN degree, Bachelor of Science in Nursing, to become a registered nurse. It takes about four years right after high school. So there is, if you want to do any, so right after high school, you go into 4 years of the BSN degree. You do not need to do an undergrad 4 years for this. This is considered a Bachelor of Science in Nursing degree. If you decide to specialize, then there is 2 years of graduate degree, which is the MSN or DNP. Then you take the National Board Certification exam in your specialty and the licensure exam. So about 6+ years of education and training. Most of the times, nurse practitioners are in a hospital kind of setting as compared to the physician assistants who are in the private offices or clinics or medical offices kind of a setting. Their roles are very similar, but the setting that they are in is slightly different. Psychotherapists, or as we know them as counselors. A psychotherapist is a trained mental health professional who helps people manage their emotional, behavioral, and mental health issues through talking. They treat conditions from like stress and relationship issues to depression, anxiety, trauma, alongside medication. Many times, counselors do work with psychiatrists and who prescribe the medication, do diagnosis, but the counselors are the ones who see these patients more often for their therapy. To become a psychotherapist or a counselor, you need a bachelor's degree, 3 to 4 years with major in psychology, sociology, or social work to build fundamental knowledge. Master's degree in counseling, 3 to 4 years with major in master's degree in counseling, which is the MA or MS. Social work, which is the master's of social work or marriage and family therapy. This takes about 1 to 2 years. Doctoral degree, which is the PhD, that's optional. Very few people go for that. It is a very long route, but very rewarding. It is needed to do any kind of research or specific clinical roles. You pass the national and state exam after you're done with whichever degree you pick. And these exams are EPPP for psychologists and National Counselor exam for the counselors. Then you get a licensure to practice from your state. Physical therapy assistance. PTA, as it goes by, works under a licensed physical therapist, which is a PT, to help patients regain movement, manage pain, and improve function through exercises, modalities, and hands-on care. Pay is about 60 to 65,000. Associate's degree is required for this from a CPTE accredited program that takes about 2 years. Clinical experience after that 2 years for 1 to 2 years under a physical therapist, and then licensure exam, which is the NPTE, and total of 3 to 4 years of education and training. Dental hygienist. High school, so these are now, from this point onwards, most of these career paths do not require you to have a college degree before you choose this path. So most of these are high school or right after high school or GED. So for dental hygienists, you go for an associate's degree in dental hygiene, which is the AAS or ADA from an accredited program. Make sure you do get registered for under an accredited program, which is accredited from Commission of Dental Accreditation. This associate's degree takes about 2 years. You can also do a 4-year bachelor program in this. Then you take the licensure exam, which is the NBDHE exam. It's a written exam, and then you take the clinical board exam for the state you decide to practice in. It is a state-specific exam. Total of 2 to 4 years of education right after high school. Pay is $80,000 to $95,000. There is a huge demand of dental hygienists today. Nurse. To be a nurse, you need an associate degree in nursing. So this is, again, right after your high school or GED, 2 to 3 year program, often at community colleges, focusing on your foundational nursing skills. You can also do the BSN, which is the bachelor's degree of science in nursing. It's a 3 to 4 year university degree offering broader preparation in leadership, research, and complex settings. Diploma in nursing is also a possibility. It is less common. It is more of a hospital-based program focusing heavily on hands-on training only. There is no licensure exam to be registered. Total of 2 to 4 years of education and training after high school. Even though there is no licensure exam, a certification, either associate degree, bachelor's, or diploma is required. Medical assistant, they go by MA. This is a certificate program for 9 to 12 months. You can also do an associate degree for 2 years. Clinical internship is required in this for about 1 year. The certifications are CCMA, which is a Certified Clinical Medical Assistant. It's offered by the NHCA. And I know it's going to be hard for you guys to remember all this, but this is all in the presentation. It's getting recorded. These will be good reference points if we do decide to do a one-on-one. There is also certification, which is called the RMA, which is Registered Medical Assistants. It's offered by American Medical Technologists. It's 2 to 3 years of education and training after high school. Patient care tech. Patient care tech, which goes by PCT, they provide essential hands-on support to patients working under nurses to help with daily activities like bathing, dressing, moving, while also monitoring their vital signs, collecting specimens, offering emotional support in settings like hospitals and nursing homes. They are very crucial for direct patient care. PCTs also, even though it does not really specify that this is one of their roles, PCTs are also very helpful in any PT, physical therapy kind of setting to help patients with doing their therapy sessions and helping them with their exercises. Their salary ranges from $37,000 to $43,000. There are state-approved PCT training programs. There are certifications required for this. These programs are 6 weeks to 6 months, and certification exams are conducted by NHAS, and those are called CPCTA exams. CNA, which is a Certified Nursing Assistant. So CNAs are vital healthcare workers who help patients with daily living activities, which is pretty much like the PCT, bathing, dressing, eating, and vital signs under the supervision of nurses working in various settings like hospital, nursing homes, and home care. If you notice, the difference that I told you earlier between PCT and CNA is that PCT is more in a direct patient care setting in hospital, nursing homes, but also in private clinics. CNAs mostly work in hospitals, nursing homes, and home cares. Their salaries are a little bit below PCTs, which is 19,000 to 21,000. You complete a state-approved training program, which is 4 to 12 weeks. It is a much shorter program, if you notice, than PCT, but it gets you through the door and gets you pretty decent pay. There is a certification exam, which is written and skills exam after you complete the program. And then you don't need any licensure. You basically list yourself in the state under your state's nurses aid registry. Why become a CNA or PCT? A PCT or CNA certificate is a great entry point. It's a stepping stone to get your foot through a healthcare setting. It's a great first step into healthcare. You can start in these programs as early as in high school to explore your interests and see if the medical field is even right for you. It gives you a hands-on patient care and lets you decide if you have what it takes to be in a patient care role. Patient care tech. Now, the same thing, PCT, it costs $500 to $3,000 to complete the certification. Length is 6 weeks to 6 months. Program types there are online programs, which are self-paced options from U.S. Career Institute, or there are more comprehensive ones like MedCerts, which cost a little bit more. There are a lot of community college certificates that are offered to complete the PCT. Those cost about $1,000 to $3,000 for shorter programs. And there are vocational or training schools that also offer these programs. National certifications are Certified Patient Care Tech, which is the CPCT from NHA, or the Patient Care Technician Certification, which is the PCTC from AMCA. Phlebotomy techs. Phlebotomy tech or phlebotomist is a healthcare professional that specializes in drawing blood for tests, transfusions, donations, or any kind of research. Pay scale is $40,000 to $43,000. Education is high school or GED, followed by completion of a phlebotomy program, which is a certificate program or a diploma. It can range from 8 weeks, which is a certificate program, to 1 year if you decide to go into a diploma. Cost is $500 to $2,500, and the certification is called a CPT. Pharmacy tech. Pharmacy technician specializes in drawing blood for test, transfusion, donations, or research. I think I have this wrong. I'm sorry. So for pharmacy techs do not draw blood. I'm sorry, I have this slide wrong. I'm going to go into so pharmacy techs basically are the technicians that fill your prescriptions in the pharmacies when a prescription is called in. Their pay is $38,000 to $45,000. Education is PTCB, which is a recognized program. It's a structured course, 3 to 12 months. There is on-the-job training, which is about 500 plus hours of experience as a pharmacy technician, often under a trained and licensed pharmacist. Certifications are highly recommended for this, even though it is not required. You can pass the pharmacy technician certification exam, which is the PTCE from PTCB, or similar exams like the EXCPT by NHA. Dental assistant. Dental assistant supports dentists during procedures for preparing rooms, sterilizing instruments, passing tools, taking x-rays, managing patient records, while also educating patients on their oral hygiene, working in dental offices, and often requiring certification for career advancement. Pay scale is $33,000 to $50,000. Education is after high school. You enroll yourself in a certification program, which is accredited by CODA, which is Commission on Dental Accreditation. It is a 1-year program. You can also do an associate degree at a vocational school, community college, or a technical institute. That is 1.5 to 2-year associate degree program. And then you take the DANB exam, which is to get certified dental assistant. It is an optional certification, but highly recommended. Entry-level dental assistant continue. So for entry-level dental assistant, the pay is about $30,000 to $40,000, which is pretty good for entry level. There are certificate courses offered at Springboard or community colleges. Those are for about 3 months. These courses cost about $1,000 to $2,500. These are really good courses if you want to even just consider dental assisting. You're not sure if you're going to like it. You want to consider it. You do these courses. They're not expensive. 3 months. Try it out. Become a dental assistant. You don't have to be certified. Get an entry-level job. Get some additional certifications, which most of the times employers pay. One of the common ones is coronal polishing certificate, which costs about $325, often paid by employers. And you decide if you do like the dental assisting and if you want to go and proceed into the actual certified dental assistant role. Medical administrative assistant. MAA handles the front office operations in healthcare, focusing on patient scheduling, medical records, management, both paper and electronic, all the billing, insurance verification, handling correspondence, and general office duties. Their pay ranges from $40,000 to $50,000. Education is right after high school. You can enroll yourself in a certificate program at a community college, technical school, or there are online providers. These certificate programs are around they are about 1 year programs. Then you get a certified medical administrative assistant. You pass the certified medical administrative assistant exam, which is conducted by NHA. It is an optional certification, but highly recommended. Medical biller and coder. Medical billers and coders, these are healthcare administrators who convert patient services into financial claims. They translate patient diagnosis and procedures into universal codes, which are the ICD CPT codes for insurance claims. They submit these codes to the insurers and patients and manage the reimbursement process. The pay scale is $30,000 to $45,000. Managerial roles can get anywhere from $100,000 to $150,000. This is a very highly paid profession that is, if you are good at the skill of detail orientation and you have the eye for the details, then I would strongly recommend this particular field. Medical coders, they review patient records, extract services and diagnosis, and assign the ICD codes and the CPT codes. Medical billers, they use those codes that medical coders gave to create and submit claims to insurance companies, track payments, and handle any denials. The combined role, which is quite common in most settings, is the professionals. They perform both coding and billing. And this is a very vital role in healthcare. Not only the pay is very high, but many settings will also give you good incentives, financial incentives and bonuses based on how you handle the payments and denials and how quickly and efficiently you have the turnaround for those payments. Medical biller and coder, how to be one. For education, after high school, you do a certificate program, which is for 6 to 12 months. There are diploma programs for 1 to 1.5 years. You can also do an associate degree for 2 years. Certifications are through American Academy of Professional Coders, which is the AAPC, and American Health Information Management Association. The CPC, which is the AAPC, through AAPC, focuses on physician-based coding, which is the private clinics. CCS is a comprehensive coding credential, and CPB is a medical billing certification. I'm going to cover the GED now because we looked at a lot of the healthcare professions which you could jump into, right? Either a certificate, diploma, or associate or a bachelor degree right after GED, GED is the abbreviated form of General Educational Development. GED is a high school equivalency credential earned by passing a set of 4 exams in core subjects, which is the math, science, social studies, reasoning through language arts, that demonstrate skills equivalent to a traditional high school diploma, offering opportunities for colleges, better jobs, or even military services for those who didn't complete high school. It is a credential proving you have high school level knowledge and skills. This is an alternative to a traditional diploma for adults, typically at the age of 16 plus, who didn't finish high school. GED is a requirement to get into any skilled labor in the United States. How to get GED? So there are free GEDs that are offered through state-funded programs, like in Illinois. There are codes, Illinois State, that offer free programs. There is workforce development programs that are offered to get free GEDs. There are nonprofit scholarships by finding free online classes and practice materials organizations like USA Hello or GED Works. Many local colleges and community centers, including libraries, offer free prep courses. Your state's community college board or adult education centers are great starting points to find local free options and vouchers for test costs. For GED, your best guide is to visit the official GED site, which is very simple, ged.com, for state policies and resources. Help for GED. Your first go-to should be libraries that offer a mix of in-person classes, online tools, or even diploma programs to adults to achieve their goals. How libraries provide these GED help? There are in-person classes. They partner with community colleges or literacy centers to host these classes at various library branches. There are online resources offering access to platforms like Brainfuse or Learning Express Library, which is a self-paced study and live tutors. Career Online High School, which is the COHS, they provide free accredited online diplomas for adults with library cards in some areas. There are testing vouchers. Some programs even offer vouchers to some of these programs through the libraries. They also offer vouchers to cover the cost of your actual GED. Check your library, local library's website. You want to look for the tab Adult Education, Lifelong Learning, or GED Help, or School Equivalency sections. Contact your library directly. If you're not able to find this information on their website, you can ask the librarian and find out if they know of any local partners.
This is very, very useful, Dr. Arora. I think we're also, as you said, that we'll be providing these slides through YouTube. We have a few questions come up. Will you be taking that after, or
yes? So I'm just left with like maybe 3 or 4 slides.
Sure. Okay, sure.
Okay, so I just summed up the GED here. It covers math, science, social studies, reasoning through language arts. You can take all 4 together or one at a time at an official GED test center. GED is an all-inclusive prep program with personal bilingual advisor, which is very helpful for our foreign clients, and top-rated tools, practice tests, and GED test until you pass. So the cost is about $36 a subject. You can do in-person at test center, official GED test, same-day scoring, personalized score report, transcript, and diplomas. You can take the test at a local test center, and there are discounted retakes. This is where I'm going to be covering the ECE just briefly. ECE is the Educational Credential Evaluators. It is a nonprofit organization that prepares foreign education credential evaluation, and it compares the academic and professional degrees earned in another country to the academic and professional degrees earned in ours. Colleges and universities, employers, licensing boards, and governments use these academic assessments to evaluate foreign education as part of the admission, hiring, and immigration. Chances are, if you are from a foreign country and you have some kind of a high school or college education and you're pursuing any career in healthcare, you will need to go through ECE to get your educational credentials all evaluated by ECE. Cost for ECE evaluation is 110 to 250 depending on the report you want. And these reports range from basic general to general with grade point average, course by course, or even high school and university level course by course. So this is something I would like to, as a doctor for little over 24 years now, I would like to emphasize that there are some soft skills that are needed for healthcare jobs. And I would, if you are considering healthcare, I would like you to pay a lot of attention to this particular slide. And I want you to question yourself and ask yourself and think, that do I have these soft skills? The most important soft skill is the empathy and compassion. You want to be able to connect with patients physically and emotionally, and their challenges to build that trust. You want to have good communication and active listening skills, so you can hear your patient's needs and collaborate with the teams. You're going to have critical thinking and problem solving, and so you can make quick decisions, informed decisions in complex situations. As you all know, healthcare can be very complex and pose many situations, and each one is unique to itself. There is teamwork and collaboration involved as you'll be working with diverse healthcare professionals. You need to be resilient and you need to have good stress management skills because it is a high pressure, fast-paced setting. You should be able to adapt and be flexible, and respond to challenges and changing protocols as healthcare is advancing very fast and there are new challenges and so new protocols are set in place more and faster than any other field out there. You need to be professional and have good work ethic. You should be able to hold high standards. Confidentiality is very important in the United States to be in healthcare, and have a good ethical behavior. Work ethic and positive attitude are very important, and a dedication and that confidence that you do have, that you can deliver to the patient and their needs and listen to them and give them the best care that is possible in your skill set. All right. I think that sums up my presentation. I would like to invite the questions now. I'll stop sharing. Pramlaji, would you like me to stop sharing or keep this slide on?
I think you can keep this last slide. Anyone from the audience,
Okay.
if you have any generic questions, if you have very specific ones, we would recommend to set up one-on-one. Please send an email to info@sanjeevaniforyou.com. But if you have any general questions related to this, please you unmute yourself.
Yes, Sri. Oh, sorry, it's Janani?
Yeah, right.
Yes, Sri.
Actually, yeah, I just went through the slides and I was like curious about the GED because like already I have my degree, master's in computer science. So I think the tech side would be more helpful for me to pursue more about the course. And so if I already have pursued my degree like in computer science, like what do you think would be the best fit for me in this field?
So, so here's the my question to you. If you already have a computer science degree, if if you don't mind, can you just give me a basic idea of why you are planning to switch to healthcare? That would help me guide you in the right direction.
Yeah, sure. Like, I'm not into IT actually, but I do worked as a lecturer, and I don't do like a IT job, regular job. And by these days, like the IT has been developed somewhere to the sky level, and it's so hard for everyone to find a job, and the AI is almost taking over everything. So, like as you said, like
Mhm.
initially you just mentioned a word like the healthcare, it's like booming, and the forthcoming days and years, the health is going to get boomed, and we do get more opportunities in that field. So I just want to focus my area like where the future is going to be. Though my sector is in computer science, with that the area where it is going to boom, I just want to place my leg over there in that field.
So, with your background and your extensive, your extensive degree and the skill set, I would recommend considering medical biller and coding,
Yeah, okay.
because
Yeah,
that would be requires very strong computer skills, and since you have will catch on to these skills much faster. I actually personally know of a few people who have switched from computer science or technology degree to computer to medical billing and coding, and they are doing really well. So I would
yeah.
consider that. So if you would like, we can set up a one-on-one, and I can
Mm-hmm,
help you find some courses.
mm-hmm.
Since you are already very tech savvy, good thing is that for medical billing and coding, you really don't need to go to any in-person classes.
Okay.
All of that training is online. I can work with you hand in hand to find you some good, certifications out there. First, the course, to learn about the skill, and then get the certifications. I
Oh,
have
okay.
full faith that you will thrive in that.
Yeah, okay. Yeah. Mm-hmm. Yeah, got it. So